Hi, today in this module, we will learn about laboratory diagnosis of influenza-like illness. Influenza is an acute respiratory illness caused by infection with influenza virus. The illness is known to affect upper and lower respiratory tract and often accompanied by signs and symptoms such as fever, headache, myalgia, and weakness. Outbreaks of illness of variable extent and severity occur nearly every winter, and it is still considered to be a major public health concern. Now, accurate and reliable diagnosis of influenza virus is critical for rapid initiation of antiviral treatment. Now, let's see what are the approaches which is utilized for making influenza diagnosis: specimen collection, demonstration of viral antigen, rapid antigen test, isolation of influenza virus from clinical specimen, serological assays, and molecular methods. So let's see specimen collection first. Throat swab, nasopharyngeal swabs, lavage fluid, and nasal aspirates are considered ideal sample. Throat swab and nasopharyngeal swab should be preferably collected using a polyester or Dacron swab, whereas cotton and alginate swabs are unsatisfactory because they are known to contain some inhibitors. Once the sample is collected on a swab, it should be placed in a viral transport media, which ensures the viability of microorganism, and it should be kept at 4 degrees centigrade. Now let's see about the different approaches like demonstration of virus antigen. So the demonstration of virus antigen on the surface of nasopharyngeal epithelial cells can be done by using direct immunofluorescence assays, which use fluorescence tagged antibody using fluorescent microscope. This technique is simple, rapid, because it can be of short turnaround time, although it is considered less sensitive. Less sensitive in the sense that the sensitivity, when it compares with the molecular methods, are only around 60 to 80%. These tests, although, can differentiate between influenza A versus influenza B viral infection, but they cannot subtypes the various subtypes of influenza A. Now let's see the rapid antigen test. Rapid detection tool detects influenza viral antigen and screened patient suspected of influenza. Based on detection of viral antigen in respiratory secretion of patient by immunological methods like enzyme immunoassay, lateral flow assay. These rapid antigen tests are easy to perform and can provide results within 30 minutes. So they can be used as a point of care testing. However, each test varies with regards to whether it can be distinguished. It can distinguish between different influenza like influenza A and B. At the same time, it is also unable to specify the subtypes of influenza A, like it cannot differentiate between H1N1 and S3N2 like direct antibody detection test. Now, regarding isolation of virus, so isolation of the virus can be performed by inoculating either an embryonated egg or using certain cell lines like monkey kidney cell lines, which is MDCK, that is maiden derby canine kidney cell lines, or A549 cell lines. The eggs, embryonated egg, can be inoculated into amniotic and allantoic cavity, and the growth of the virus can be detected at 37 degrees centigrade after 3 days. Whereas monkey kidney on cell lines the virus may be looked for the cytopathic effect after 7 days. Virus growth can be detected by heme adsorption, heme agglutination of the guinea pig, and foul erythrocytes at 37 degrees centigrade. Virus isolation face certain technical difficulties, so it cannot be used for diagnosis, but it can be useful in some clinical situations, like for the further characterization of the viral strain, or where culture confirmation of suspected false positive RT-PCR results are there. Now coming to the serology. Antibody to several viral proteins like hemagglutinin, neuraminidase, ribonuclear protein, matrix protein can be detected using serological test. Antibody starts after 2 weeks and peaks around 4 to 7 weeks after infection. These antibodies can be detected by using either complement fixation test, which is done on testing on paired sera, and increase in more than 4-fold rise in titer often indicates viral infections. Other antibody detection tool use heme agglutination inhibition test, neutralization test, as well as radial immunodiffusion test, which can be also used. Then serological tests are not useful in diagnosis for most clinical scenario. However, it can play important role in certain special situations, like in the absence of previous vaccination or infection with a particular strain. Example, when a novel virus emerges to which there is no pre-existing cross-reactive immunity, a single specimen with positive titer is diagnostic. At the same time, serology can also be helpful in establishing a diagnosis of novel seasonal viral infection beyond the period when the culture or PCR results would be positive. Now coming to the molecular methods. So rapid tests based on detection of influenza RNA in clinical specimen using reverse transcriptase polymerase chain reaction, that is RT-PCR, are performed to diagnose influenza. RT-PCR involves 3 essential steps. First, extraction of the viral RNA from the clinical specimen, followed by the reverse transcriptase of the RNA to complementary DNA using reverse transcriptase enzyme, followed by amplification as well as parallel detection using fluorescence probe. Now, this test is rapid and can be performed in a single day. At the same time, it is good sensitivity and it has good specificity. So this test is now accepted as a gold standard diagnostic method for the diagnosis of influenza virus. With this, I come to an end for laboratory diagnosis of influenza virus like illness.